Dr. Angela McKaye, chiropractor and naturopathic physician, and this month of November we are talking about men's health. This week in particular we're going to talk about testicular health, and I want to talk to you a little bit about testicular cancer. So even if you're a woman, listen up, because this may affect somebody that you know and care about. Testicular cancer is very rare. It got a lot of press because Lance Armstrong had a struggle with testicular cancer, and so he's shone a light on that and brought some attention to the issue, but it is very rare. And even Lance Armstrong, you know, I read his biography, it's been a while, but he said that he let it go until the tumor was about the size of a grapefruit, which seems crazy to me. Why would you let that happen? I think in his case it may have been some irritation from sitting on the bike seats frequently may have created some inflammation and irritation in the area too that may have led to some of that. So I want to emphasize this is something that you should be aware of, but not something you really need to fear. Just making sure that you're checking frequently and taking care of yourself, and that you report anything unusual to your doctor as soon as possible, because it's true with any cancer that if you catch it early, the treatment and the prognosis is way better the sooner you catch it. And testicular cancer often is pretty well treated, even if it's caught later, but always with cancer you want to catch it early. The mean ages of men who are affected by testicular cancer is from the age of 15 to about the age of 35. Now that's the most common age range, but it can happen at any time. And this is important to let your sons know or young men know about this so that they can be alerted to it, because most young men think that they're invincible and nothing's going to happen to them and they're going to be healthy, and they just take that for granted. So this is an important way to start emphasizing self-care, I think, for young men. For parents out there who have sons, whether you're a mom or a dad, and it can feel a little awkward the first time, and your kids might groan. My kid's always grown, but being open to talk about just basic health information is really important for them to feel comfortable with their body and to be able to alert you or their doctor if something's not going right. But this is really just teaching them good self-care and how to take care of their health, and their genital health is as important as their fighting off colds or flu, or their musculoskeletal health, or their mental health. And so this is something that's important to talk about with your kids in terms of how to take care of just their general well-being, and when to check in with their doctor, and know how to do the basics of like nutrition and sleep, and doing your self-checks to make sure that you're healthy. So the symptoms of testicular cancer are a painless lump or enlargement in either testicle, a heavy feeling in the scrotum, a dull ache in the scrotum, or groin pain or swelling, sudden collection of fluid suddenly in the scrotum, and possibly shrinkage of a testicle, and then pain or discomfort in the testicle or scrotum, and then enlargement or tenderness of the breast tissue, and also low back pain. Those are all common. You may also find enlargement of the lymph nodes in the groin, where the immune system is trying to handle the cancer. Some of them are very vague symptoms. So if you have one or more of those symptoms, please don't just automatically assume that you have testicular cancer. Go get it checked out, but don't be super fearful, because there are other things that can cause that. More often than not, it is something else. So it may be awkward to make an appointment to go talk about your genitalia with your doctor, but once you get over that initial awkward thing, doctors don't care. It's just another body part, and it's our job to take care of you. So once you get over that initial weird feeling, it's fine. No big deal. Just get it looked at and then move on with life. Risk factors for testicular cancer are if you've ever had an undescended testicle, and so that happens sometimes with men as infants, where the testes start out in the abdomen, and then with development they descend into the scrotum and outside the body. A lot of times this happens with infants, and then it'll descend on its own, and the doctor your pediatrician will just check for that, and it'll just happen over time within the first 3 to 6 months of life. And if not, then they'll often do surgery to help the testes descend, and that usually is not very much of a problem. It raises the risk of testicular cancer only very slightly, because even with men who've had that issue as an infant, the risk of testicular cancer is still incredibly low. Other things that increase your risk of testicular cancer are genetic alterations, like Klinefelter's. And so Klinefelter's is you have 3 sex chromosomes, and you may not notice this early on, but you might notice it in a kid just as they're approaching puberty. So that raises the risk of testicular cancer a little bit. We don't really know what causes testicular cancer, so it's a little bit tough for me to say what prevention measures you should take. In general, I'm always going to say that a well-rounded whole foods diet with lots of fruits and vegetables and fiber is going to be preventive for cancer. Something like the Mediterranean diet or a paleo diet, or just eating a well-rounded whole foods diet is just generally all type of cancer prevention. If you have any questions or comments or anything you'd like to add, drop it in the box, shoot me an email, and I'll have a few more tips about this soon.